All right, talking about athletes, and we've been talking about sort of the breathing impact of athletic performance. And I think for us, we see patients all the time, athletes, non-athletes. But I think sometimes those stories, sometimes for me, when I'm in clinic and seeing patients or on the back end of procedures for folks, and we get somebody who was suboptimal, optimal, and their stories, those are really poignant. And I know we've, as far as athletes that you've seen, any particular ones that come to mind that sort of were like, wow, boy, this person really needed the change that we're able to deliver.
Yeah, I mean, I can think of one in particular that was a collegiate power lifter and big kid, and I don't know, probably 6'6". And I don't know a lot about powerlifting per se, but I can imagine it requires a lot of strength, obviously. But like, he complained primarily of not getting good sleep at all and not being able to breathe through his nose. And obviously, two essential qualities, I think, to performing your best, but especially in that kind of setting where a pound difference apparently can make a world of difference for what you accomplish in that world of powerlifting. So anyway, we did a scan, and his history was obviously very specific for not being able to breathe well through his nose. And then I was worried about sleep apnea. He's a big kid, that kind of thing. But that scan, I mean, his nose was like shut down, like shut down. And of course, and he never breathed through his nose anyway. And so it made a profound difference for him. Didn't end up having sleep apnea, which is good, but sleep quality improved just by virtue of getting his nose open. So, and I asked him to give Advent, of course, a shout out. He won a world title. Kidding. So but never heard back from him.
What's your excuse for not being the world champion powerlifter? If his nose is jacked up and he still was able to crush it, why can't you crush it with your nose?
It's because on my 140-pound frame, I don't think that's going to be happening.
So I mean, genetics. Well, so let me go this. So athletes who have issues breathing through their nose, is that genetics? Is that environment?
That's a good question. So I think that it's multifactorial. Lots of things can play a role. Genetics can hurt you, especially from aligning, right? Because we always talk about, hey, there's two problems in the nose. It's anatomy, it's lining. Genetics play a role of lining. The way you react to the world around you is inherent in your DNA.
Correct.
Right? But the anatomy is a large factor in that story. And if your anatomy is unfavorable in your nose, meaning it's shutting you down, you're kind of screwed.
Although, humans are resilient, and so, one can assume if you're, a competitive power lifter that your genetics are favorable to do such a thing.
Correct.
But that's good, and then go with the flow there. But then it doesn't mean that your nose is genetically on your side either. And in fact, most of the athletes we see are compromised that way. And it's almost remarkable that they can do what they can do with the nose that's hurting them every breath they take, every single breath they take. It's like, meaning like if you're going to start two athletes off and, genetics are going to really play a role in a lot of that, but breathing plays a crucial role into much of that. And so it's amazing how resilient human beings can be in the face of struggle and challenge, kind of a thing. And it's almost like, and again, if somebody is, to me, it's almost analogous to training at altitude.
So why do athletes train at altitude? What's the whole purpose there?
Yeah, the purpose there is to get an edge on the rest of the competition. So when you're training at altitude, you are basically restricting your breathing capacity in a way, because there's less oxygen in the air at altitude, and so you're forcing your body to fight against a situation where it's harder. So that you go to altitude so that when you come out of altitude that you're stronger than where you were when you left off. The opposite's true too. There's a reason why playing in Denver has always been through the years really hard, because you take somebody who's living on the ground here, you take them up, put them on a mountain, and decrease their oxygen capacity, it's going to hurt them.
Right.
And so, because it takes a while to become strong through that. And so here on the ground, we see folks all the time who are basically struggling through life where their intake valve is partially shut down or completely shut down, and they're fighting it. They don't get the benefit of kind of taking the chains off that way immediately. They can't do it on their own, I guess is what I'm saying. And so they need our help to both identify that there's an issue there and correct that issue so that we can send it back out in the world as stronger. But it's actually part and parcel with that. I mean, there's a reason why people go to great lengths to challenge themselves from a aerobic capability standpoint, but there's not a reason to do that unless the tools that you have are causing you to do that on a constant basis. That's not helping you.
Right. I mean, imagine an athlete trying to, let's say it's, a NBA player and they're playing their basketball game, and imagine them playing a game with like a clip on their nose, right? Mm-hmm. So the nose ain't working at all.
Yeah, absolutely.
Then they play a game with a clip off their nose, and still they're not optimized, right? They're still breathing what their normal baseline is. And then imagine like a level up from there. So I mean, it would give people a perspective. And I think people can relate to that. Like, hey, if I'm not breathing through my nose, and then I take that clip off, and I'm getting just my normal baseline, and it's that much better. Like, think about what it could mean for you performance-wise if you actually get your nose working.
Absolutely. Yeah. I mean, it's a big deal. I mean, another way to look at that too is if everybody's had a cold. If you're an athlete and you have a cold and you go and perform. Think about your performance on those days, and part of that is just the overall effect of your body fighting a virus. But part of that is the fact that the cold is causing your nose to get shut down. You're just not breathing properly. You're struggling.
Right. So, maybe these players wouldn't have to take so much game management and take a day off on a doubleheader. They could actually play all 82 games.
Maybe Kawhi would be like able to hit all every game.
I remember when Kobe Bryant, and Michael Jordan, they used to play every game. Flu or no flu.
So maybe we need to check their noses out.
We probably should.
Maybe Kawhi needs a personal intervention with us.
Yes.
Although now that I think about it, Michael Jordan, his famous thing and move was his tongue out when he was jamming. Was he signaling to the world that he needs some help, or was he
or just in your face, in your grill? Yes.
Yeah.
It's a good question.
Yeah. No, but it really is. It's important. Because it's important doesn't mean you can't make light of it though. On the flip side, because
right.
But yeah, I mean, I think it's certainly something to consider. Certainly something that you don't have to be a professional athlete. So it doesn't matter. You don't have to be Kawhi Leonard. You could be, Joe Smith, who just wants to be their best self, and you like to work out. You like to whatever it is. You like to run. You like to whatever it is. That starts with breathing properly through your nose. And if you're not doing that, that's hurting you. And I think for non-professional athletes, peak performing athletes, I would venture to bet that it is a barrier to entry for a lot of folks. Meaning, if your nose isn't working, and therefore every time you hit the treadmill, hit the road, hit your bike, you're just struggling to breathe because you got to drop your mouth open, your mouth breathing the whole time. That's going to condition. That's a punishment to exercise. So it's going to condition your brain to say, man, when I go to exercise, it sucks. I cannot breathe properly. And you might not connect the dots here, like consciously, but subconsciously, your brain is going to say, dude, take a day off. This is it's too hard for us to continue on like this. And so I would venture to bet there's a lot of folks that are shortchanged because their nose doesn't work properly from an athletic standpoint, that they haven't really connected the dots there.
Right.
Because it can only hurt you. It can only be something that is going to make it harder to do what you're trying to do to begin with.
And it's an unnecessary barrier. Like, it doesn't need to be there and be a problem for someone who wants to get into exercising.
Yeah. Well, I guess and back to sort of like, what do you do with that? What you do with it is identify that as a possible problem. And the good news is nowadays there's really easy ways to get better, to push through that, to get it out of the equation. And so it's just a matter of really creating that awareness, which I think is important, because if it's impossible. So I guess what's the point of talking about all this is all the people out there who are suffering, athlete or non-athlete, with issues that are easily correctable. Why suffer? And there's no reason. I mean, like that's not really an existential question. It's just there's no reason. Like there's no reason. There's no reason. It's just a matter of getting it out of somebody's way, which is powerful. So I think, again, for all the professional athletes out there, down the ladder to really the 8-year-old kid who's on the soccer field who's trying to do their best, it starts with the nose from a breathing standpoint, and it's crucial. It's powerful when you can breathe properly, and it's deflating when you can't. And so it's sort of, I would say it's absolutely time to do something.